and welcome to our Community Service Excellence Project. We are a group of vocational nursing students from Weatherford College, and today we will be discussing a critical public health issue affecting Tarrant County, and that is mental health. Through our research using the county health rankings and roadmap, we discovered that mental health challenges, including high rates of depression, anxiety, and suicide, are increasing throughout the county. In particular, Tarrant County reports an average of 13.6 suicide deaths per 100,000 residents, a number that was steadily risen over the past 2 decades. As future nurses, we believe it's vital to address this growing concern by identifying contributing factors, exploring available resources, and proposing realistic solutions that can benefit individuals and families in our community. In this presentation, we will talk to you through our findings, introduce local resources that can make a difference, and offer evidence-based interventions aimed at improving mental wellness across Tarrant County. Identifying the need for mental health services in Tarrant County is important because it helps address a growing demand for care, especially as the population increases. Many residents face limited access due to shortage of providers, and untreated mental health issues often lead to emergency room visits, jail time, or long wait list for services. By recognizing these needs, the county can allocate resources more efficiently, more effectively, support early intervention programs, reduce strain on law enforcement, and improve overall community well-being.
County Public Health Department released a data brief over the last 5 years for mental health, showing a trend of mental health being reported as not good or poor, going up by about 11%, and frequent mental health or mental distress going up by 6%. That trend seemed to be more prevalent in those aged 18 to 24 and 24 to 44. And going to the Tarrant County health rankings, we can see from a census report, poor physical health days being higher than average for Texas. Poor mental health days also being in the ratio between patients versus providers. We have a lot less providers than most of Texas and the US. Many people report insufficient sleep, higher than average for Texas and the US. However, we do have a lot of things that are going well for Tarrant County, including access to exercise opportunities being well above average for our state, and then access to parks way higher. There are one-on-one or even group therapy may not be for everybody. Other options include exercise, having a productive hobby. The census report reports higher than average access to exercise opportunities. This benefits of such include being outside in nature, sun and vitamin D. Vitamin D helps with serotonin production, increases your metabolism of calcium and phosphorus, and it even affects your sleep cycle. Sleep being another thing that Tarrant County reports having a higher than average number of people who suffer from insufficient sleep. Outside allows you to explore your neighborhood and town, learning what your area has to offer, including parks. Tarrant County has a higher than average access to parks where there's a ton of access to free exercise equipment, activities such as disc golf, basketball, volleyball, skate parks, hiking. It allows for socialization. All of these aid in stress relief, but other options for stress relief include general things like massage, acupuncture, acupressure, meditation, deep breathing exercises, and general things like self-care can help with your mental health. Better sleep, and generally organizing your life. Tarrant County reports a higher than average food environment index that includes access to healthy food and just general lower prevalence of people being fearful of not having access to food.
Tarrant County actively engages in various mental health activities and interventions to support the well-being of its residents. These efforts aim to raise awareness, reduce stigma, increase access to care, and promote early intervention, all of which are essential to a healthier, more resilient community. Some interventions that are already in place are MHMR, JPS, school counselors, and nonprofits like Mental Health America of Greater Tarrant County. Currently, they have MHMR, that's a 24/7 support service. They help with immediate 24/7 support, ensures people in crisis receive care quickly. This helps de-escalate situations and connect individuals to long-term services and potentially save lives. Helping with behavioral health diagnosis, financial assistance, medication management, and treatment options. Some of the services that they offer are child and family services, intellectual and developmental disabilities, mental health services, substance abuse, crisis services, homeless services, veteran training, and this training is helping mental health, first aid, and other training opportunities for employees to help the members of its community.
Okay, so touching a little more on the interventions in place with Fort Worth ISD. The Fort Worth ISD does offer family resource centers. These provide services for both children and their families. They work with the other programs in mental health community in Tarrant County that can provide services for students as well. They will make sure to families to make sure that these resources are available. They also have a Communities in Schools program of Greater Tarrant County. These also are mental health programs that address issues. They do one-on-one counseling in the schools, which is good for children. They also provide, that also eliminates a lot of transportation issues that may be a problem. One of the issues with this program, however, is that currently there are 6 mental health counselors per 150 students across 3 school districts. So that's the only program that they have right now. However, in Tarrant County, there are 20 school districts with a total of 616 public schools. They serve over 370 students, so that ratio is pretty small to the students they're able to provide coverage for at this time. So finding a way to increase the number of these resources will help the counselors in the schools allow early detection and intervention. So that is a way that interventions improved. Another improvement would be more affordable interventions. We do have JPS Connection, which offers homeless services as well. Some other interventions that could be improved would be public awareness campaigns. So, for instance, the NAMI, or National Alliance on Mental Illness of Tarrant County, they do walks and stuff like that. So maybe bringing awareness to that group or any of the other public groups would help as far as bringing more awareness to mental health.
Mental health activities and interventions in Tarrant County are crucial for prevention, early identification, and treatment. They promote safer communities, reduce healthcare costs, and improve quality of life for individuals of all ages. By investing in mental health now, Tarrant County helps create a more resilient, connected, and supportive environment for its residents.
In Tarrant County, mental health can be obtained through a combination of innovative and traditional sources, like public grants from agencies such as Texas Health and Human Services and federal organizations like Substance Abuse and Mental Health Services Administration, community-based mental health initiatives, public-private partnerships between school districts, local health systems like Cook Children's, and nonprofit organizations can also help to expand access through shared resources. Integrating mental health services into primary care settings, especially in underserved communities, can unlock funding through Medicaid and reduce barriers to access. So these philanthropic foundations such as the Hogg Foundation for Mental Health and Tarrant Area Community Foundation provide targeted grants focused on mental health suicide prevention, and trauma care. Social impact bonds and crowdfunding platforms can also offer alternative funding models that reward successful outcomes. Together, all of these approaches can provide multiple pathways for supporting the mental health needs in Tarrant County.
Funding for mental health can be integrated into the primary care visits in Tarrant County by utilizing collaborative care modules, billing strategies, and state-supported programs. Primary care clinics can screen patients for mental health conditions, tools using the PHQ-9, and bill for services under Medicaid, Medicare, or private insurance using behavioral health CPT codes such as 96127 and 99484. Clinics can also apply for state grants from Texas Health and Human Services, such as the Community Mental Health Grant to hire behavioral health professionals and support integrated care. Partnerships with local organizations like MHMR of Tarrant County allow primary care providers to refer patients directly to mental health services or even licensed counselors within the clinic. These strategies not only increase access to care, but also ensure mental health is addressed as part of a patient's overall well-being during routine medical visits.
How the community get involved in mental health in Tarrant County. This is the part that we talk about. So the community get involved through education of the public, how the public take care of themselves. The community will make some education through mental health by telling the public how they can take care of their body and their mind. Give them some little astuces like sleeping pattern. You can stick to a regular schedule of sleeping. Spend some time outside if it's safe, of course. Play some sport that you enjoy or have a kind of exercise even to get stretch or walking. And then for your mind is always a good, talking is always a good idea for mental health, because talking allows you to express yourself, and this is the opportunity that let the other people or your family member or people around you know that something is going on with you, and then they can act quickly before it gets worse. You can also write down all your feelings and take deep breath to calm down your mind and slow down your heart rates. Explore some interests that you like, some habits, and even celebrate your large or small success. All this kind of stuff can help you with your mental health. And also keeping positive affirmation. So you don't talk about negative things. Keep talking about things that are positive can help you with your mind. And other thing that the community can do is through the support group, peer support group, where people that experience mental health share their experience, their story. And this is a place where they can build friendship, and because they feel you don't feel alone when you go to the center, because you find some other people who experience what you are experiencing now. So it gets you an open mind that you can open up and talk to break this barrier that you are keeping. So join the support group, talk with people who care about you and don't judge you for what you are or what you are doing, and open have an open mind so that you can get some advice from these people that you are around them to help you with your struggle. Get involved in sports and spiritual or religious organization.
Other ways the community can get involved includes advocating for mental health resources for those that are struggling to access conventional treatments, maybe for financial reasons. We need to make sure that these programs stay in functioning order, such as the 988 Suicide and Crisis Lifeline. We can consider volunteering with faith-based organizations in schools. And the National Alliance on Mental Illness, also known as NAMI, lists several faith-based ministries and spiritual support groups on their website, NAMI.org, that you can get involved with just with friends and family as a community to try to make this problem better. Furthermore, social media campaigns can be spearheaded by the community to reduce stigma and encourage struggling individuals to reach out. Examples include Fort Worth's Mental Health Community Awareness Campaign in 2021, which they launched after COVID and the mental health crisis that happened in the aftermath of that, called Recognize and Rise. And NAMI of Tarrant County's program called Wellbeing Matters. Another example is My Health, My Resources of Tarrant County commonly uses their Facebook page to post resources and ways for people with mental health problems to get support, and we can, even as individuals, repost those resources on our own pages to help. On a very intimate level, we as a community can check with neighbors, family, and friends. Open communication is the best way to really recognize when someone is changing, when they're going through a hard time. Because if you don't talk to them, you don't know when things are starting to shift within their minds.
Okay, so in this section, we'll be talking about target population and who it benefits from the Tarrant County and mental health. So we wanted to focus on groups who are most affected by mental health challenges and the ones who face barriers. Those include adolescents and young adults who experience anxiety, depression, or suicide, low income and uninsured residents who aren't able to afford therapy or medication, veterans who struggle with PTSD, homeless population who often live with untreated mental illness and limited access to care. Mental health doesn't just affect one type of person, but some groups are especially vulnerable and need support. Other groups like LGBTQ+ individuals and minority communities who may face isolation, stigma, or cultural barriers when seeking help. Who all can benefit from this? Honestly, everyone. All of us can benefit from it. All of us can benefit from it because when mental health, we do have resources. Hospitals have fewer emergency visits, there's stronger families and communities, better school performance, and safer communities. Thank you.
Okay. So some other things I would like to add to support mental health resources would be like for adolescents and like teenagers. I would suggest like the Boys and Girls Club for mentors. Sometimes we do need a mentor to kind of get us out in a better mental space. There is also a Headspace that's a free app that is available for like mindfulness tips and tricks and things like that. In my personal experience, there are my employers have behavioral health resources as well, and specifically to my employer, we have Lyrica, and that's an online tool. And I know in Fort Worth, on 8th Avenue, there is a LGBTQ clinic resource for mental health and other resources for that community. The mental health crisis is a prominent issue across the United States, and here in Tarrant County, we have outlined options to improve the situation locally. We hope our Community Service Excellence Project can help eliminate the gaps in resources and provide efficient solutions and suggestions to improve mental health for the struggling individuals in Tarrant County.